So it's Pig Week here at Lace, and so I've been getting your all's questions. And a lot of you guys are seeing a lot of 4-H and show pigs, which I expected. I hear from you guys a lot about these things. And a couple of questions that I got were related to respiratory disease, pigs that are coughing, or pigs with chronic respiratory disease that's not responding to antibiotics. And so what's causing that? What can we do? So we know that viruses, bacteria, parasites, and environment play a role in respiratory disease in all of our species and in pigs. And so when a pig has not responded as expected to an antibiotic for respiratory disease, it is time to think about what else could be going on. Could it be viral? Could it be allergic? And could it be environmental? So I think a lot of these pigs, depending on where they're housed, are in dusty environments. Pig feed is inherently dusty by the fine grind. And then certainly if they're in dirt floor pens and other things, there can be a lot of environmental irritants. We also see a lot of conjunctivitis in pigs that are housed this way. So they may both be coughing and have some evidence of conjunctivitis from shavings, dust, again, feed, those kinds of things. And so I really like to spend some time talking to owners about, if I'm not on the farm, what is the environment like? What can we do to cut down on dust? Those kinds of things that not only can cause respiratory irritation on their own, but can make an environment that's hospitable to viruses and bacteria setting up shop. Other things is getting lung radiographs. Certainly worth finding out if there's maybe some evidence of chronicity there, those kinds of things where maybe where we can't expect it to respond to antibiotics. Nasopharyngeal swabs, transtracheal washes and BALs are pretty challenging to do on pigs, but a nasal swab or a nasopharyngeal swab might be able to be performed in the field in most situations. Lungworms can occur. I think they are wildly overdiagnosed, at least in the South. But you can run a Behrman and find out if those little guys are there. So lots of options there, but I think it's always important to go back to what diagnostics do we need to do to get this done, rather than just continuing to throw drugs at that. But I would say one thing for pigs in particular I have found is to look at the environment and look at the level of dust and environmental irritants, chemicals that are being used in the barn, ammonia that may be building up that's a respiratory and ocular irritant. So looking at some of those other things rather than just assuming everything is bacterial, I think is really important.